And time now for a look at your health. Our topic tonight is Botox and the new ways it's being used, just approved by the FDA. Here with me now is Dr. Mitchel Goldman with UCSD. It's so great to have you.
Always good to be here.
Botox has become really popular. Millions of people are using it. But for people who don't know, first let's kind of go back. What is it?
Well, in the 1970s, Botox was actually developed for treating something called blepharospasm. That's when your eyelids keep moving and you can't stop it. And one of the doctors realized that it also made the wrinkles go away. And so now most people know that Botox is great for treating wrinkles. In fact, over 1.5 million Americans every year get Botox treatment. So very safe and effective. But Botox can be used for so many other things. We found out that it was great for headaches. We found out that it was great for people with spasms in their neck. We found out it was great with people with cerebral palsy that have a lot of muscle contractures. And the latest thing we found out is it's also really good for hyperactive bladder, for bladder spasms.
So when the FDA does these tests to figure out what else that it can be used for, how does that process happen? How do we know it's safe?
Well, it's not the FDA that does the test, it's the company, and in this case, Allergan. And they'll spend $10–20 million doing tests on thousands of people over years to make sure that not only is it safe, nothing bad's going to happen, but it's also effective. So for bladder spasm, that took about 3 or 4 years to go through the entire approval process. And that's why, although Botox is approved for many indications worldwide, in this country, the FDA has a real big responsibility and they require complete safety and efficacy for something to be cleared.
The latest thing that I keep seeing are these commercials on television for migraine headaches.
Yes.
How does that work?
Well, Botox for migraine headaches was actually not first discovered here, but one of the lead doctors, Dr. Rubenstein, actually did a lot of the research right here in Encinitas. And what happened was many doctors saw that when we were doing Botox for wrinkles, that actually patients' headaches went away and migraines went away. So again, the Allergan company did a huge study, and so your neurologist now can actually inject Botox into various areas on the head and the neck in order to treat migraines.
That is crazy. Migraines affect millions of people. So now that it's moving into this more medical realm rather than just cosmetic, is it something that, is the price going down and is it covered by insurance?
Well, it is covered by insurance for the FDA-approved medical indications. And in fact, about half of the Botox that's used every year in the United States is for medical indications. So we have over 1 million people getting their wrinkles getting taken care of. We have about 1 million people getting muscle spasticity and other problems getting care of. It just goes to show you that even though you think something is just for cosmetic, there's lots of other possibilities. And with a physician noticing that when he or she does a certain procedure, it makes other things better, that's how we can get really good medical care.
I have heard Botox been referred to as a miracle. Dr. Goldman, thank you so much.
It's always good to be here.
Okay, Walter, we'll send it back to you.
All right, thanks, Misha.